Hello, good evening, everyone. It's your girl, Ini. This evening, I'm going to be talking to you all about the topic ABGs. Why is this topic so important in healthcare settings? This topic is very important because this is one of the lab, or let's say series of lab values that doctors or healthcare providers always want to know with their patients. They want to know if their patient is doing well or not. So what is the full meaning of ABGs? ABG stands for arterial blood gases. So now, before I continue, I want to say to my viewers, this session is going to be interactive. So if you know anything about the topic, drop it in the comment section. And do well to like the video and also subscribe if you haven't done so. All right, let's continue. So, why do doctors always order ABGs? Why do doctors do that? Because they want to assess the respiratory function, like patients with COPD, asthma, pneumonia, any respiratory distress conditions. They want to know what is going on with the patients or with their patients. And also, they want to know oxygen status of a patient. Let's say a patient is having a decrease in oxygen level. The doctor will rush in ordering ABGs. And normally with ABGs, you can see the respiratory therapists, they are the ones to draw ABGs. Sometimes the nurses can also do that too. And another reason why ABGs are being ordered is because the doctor also wants to check kidney function, and that they are the reasons why the doctor would want to order ABGs and assess patients' kidney functions, liver functions, and oxygen saturation levels. Now, let's dive into more of this topic. We want to look at the lab values because the lab values is what we see a whole lot of times. We see a lot of this and we need to know how to interpret our lab values when we are working in the healthcare settings. So we have our lab values right here. Let me adjust my camera so that you all can see the lab values very well. Okay, so I think you guys can see the lab values very well now. So we have my lab values. My pH is always 7.35 to 7.45. My PCO2 is always 35 to 45. My PO2 level is always 80 to 100. My HCO3 level is always 22 to 26. My oxygen saturation level is always greater than 90. Take note that some patients that have respiratory issues, patients with asthma, COPDs, their oxygen saturation level is always going to be is always going to be less than 95. Some patients with COPD always have oxygen level of 85 or oxygen level of 90. That the doctor can still accept that because they know very well that COPD patients cannot have high oxygen levels, because if they have too much high oxygen level, they're going to end up having excess CO2, and that can also affect their breathing function. Okay, so now we're looking at our pH. Low pH always results in acidosis, and high pH always results in alkalosis. Let's synthesize more of our ABGs. And we're going to use the mnemonic ROM method. So ROM stands for R stands for respiratory. O stands for opposite. M stands for metabolic. E stands for equal. We're going to go back again to R. We're going to go back to R. R, which is respiratory. We're looking at when the pH for respiratory, when the pH is low and our carbon dioxide, which is CO2, is high, is going to result in respiratory acidosis. When the pH is high and our CO2 is low, we're going to end up having respiratory alkalosis. Now we're looking at metabolic. When the pH is low and our HCO3 is high, our carbon dioxide is high, we end up having metabolic acidosis. And when our pH is high and our bicarbonate is low, HCO3, we end up having metabolic alkalosis. So now let's come up here and look at the causes of respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. What causes respiratory acidosis? Things that causes respiratory acidosis are COPD, asthma, pneumonia, and carbon dioxide retention in the lungs. When you retain a whole lot of carbon dioxide, you end up having respiratory acidosis. What causes respiratory alkalosis? Anxiety. You know, anxiety is common with everybody. If you are someone that always feeling anxious, you have so much stress, you are having panic attack, you are hyperventilating, you will end up having respiratory alkalosis. So anxiety, stress, panic attacks, hyperventilation, and aspirin overdose. This is something some of us don't know, but aspirin overdose can also lead to respiratory alkalosis. And then what will cause metabolic acidosis? Diabetic ketoacidosis. How do we end up with diabetic ketoacidosis? Patients with diabetes always have an increased production of ketones in their urine. So when they have increased production of ketones in their urine, they end up having metabolic acidosis. Lactic acidosis too can cause metabolic acidosis. So lactic acidosis is found with patients with liver failure. Liver failure will cause lactic acidosis. And if they have lactic acidosis, they end up having metabolic acidosis. Kidney damage too can cause metabolic acidosis. Our next thing on the list, our last thing on the list is metabolic alkalosis. How do we end up with metabolic alkalosis? We have vomiting, excessive vomiting, NG tube suctioning. If you have NG tube and you're always getting suction from your NG tube, you can end up having metabolic alkalosis. If you are taking diuretics like thiazide diuretics or Lasix, you end up having metabolic alkalosis. If you are having excess diarrhea too can cause metabolic alkalosis. So this is the end of my session. I hope that you learned something from this session and you now understand what it means to do ABGs. You understand the meaning of ABGs. You understand the reason why providers or nurse practitioners often order ABGs in healthcare settings for their patients. Now you can tell me one of two things that you actually learned from these ABGs. Don't forget, remember to drop whatever you learned from this topic in the comment section. I will see you next time and I will bring you more educative video for you to learn something from. It is your girl, Ini. You have a good night and remain blessed. Take care. Bye-bye.